Hello and welcome. I'm Maloni Bhatt, and this is a special conversation with Sanjay Joshi of ZS, which is a global management consulting and technology firm with nearly 4 decades of experience in innovative healthcare and life sciences. Sanjay is the managing principal at ZS and currently leads its global platform business. He is a member of the board of directors. During his tenure at ZS, Sanjay has held multiple leadership roles. Sanjay also founded ZS Prize, which seeks to identify some of the most innovative ideas that may address some of the most complex challenges facing healthcare in India. Sanjay, welcome.
Welcome, Maloney.
Good to have you. Sanjay, why don't you start by telling us a little bit about ZS?
Sure, Maloney. So ZS is a global management consulting and technology firm, as you shared, and we serve kind of the both ends of the spectrum of the life sciences and healthcare industry. We serve some of the largest biopharma firms in the world, as well as some of the hottest high growth biotech companies who are really revolutionizing medicine and revolutionizing healthcare. Um, and in the spirit of revolutionizing healthcare, um, in the spirit of digital first, we ourselves are investing and taking a very active role in the transformation of the healthcare industry through the platform model. Much like you've seen industries like retail being disrupted by Amazon, industries like hospitality disrupted by Airbnb and the like. We are trying to bring a similar platform way to accelerate our digital transformation journey. And Zayden is our platform to help our clients accelerate uh, this transformation that they are undertaking through a digital first mindset.
All right. Thank you so very much, Sanjay, for giving us this insight. You're also the founders of ZS Prize. Why ZS Prize?
Meloni, when we started ZS Prize, it was in the midst of the pandemic. And the idea behind the prize, the motivation behind the prize is essentially to be a catalyst, a forum to help advance healthcare for all. Today, healthcare is really on top of the global agenda, be it countries, be it governments, be it companies. And given our depth of experience in the healthcare sector, as I shared, we wanted to create a forum, an innovation challenge that can serve as a catalyst to advance the big need of the day for all. And the underlined word here is for all. So we hope ZS Prize is a catalyst in promoting and advancing that goal through interesting startups, great ideas that can lead to better health outcomes for all.
It is definitely something that India really needs. But what is your goal, your larger goal with ZS Prize?
Meloni, we started with India given the high need, given that we have a very strong presence, a strong talent base in India. But our goal is global. Our goal is to really make ZS Prize an institution, a forum that stands for innovation in healthcare for all. Today we are in India. In the years to come, we'll be taking ZS Prize to Africa, to the Americas, and Asia.
All right, and we wish you success with it. Uh, so I want to ask you, what are the opportunities for innovation and disruption of healthcare in India from your vantage?
Yeah, yeah. As we discussed, kind of the crying need for healthcare for all is really the topic, the agenda for today. And India has been doing amazing things to make progress towards that. Of course, Ayushman Bharat, as you all know, has been a big, bold, audacious program to improve affordability and accessibility of healthcare for all. Um, Beyond that, there are new technologies and approaches that are helping us advance towards that goal of health equity. Remote diagnostics is a reality today. Telemedicine is really uh, providing lot of promise to the underserved parts of the country, to parts of the population today. Um, Data and technology are democratizing knowledge to the extent that we can understand healthcare pathways a lot better and a lot more enabling to, to the healthcare professionals. Uh, and software and digital technologies are not just enabling healthcare, they are becoming the medicine. For instance, software as a medicine, SAMDs that we becoming a really rich area for digital therapeutics. And in a place like India, where diseases like diabetes is a highly prevalent, high incidence of such chronic diseases, devices and digital therapeutics like that can be a great enabler to manage chronic conditions like diabetes. So I think in terms of the opportunity to disrupt healthcare are all around us, and very exciting times to be an entrepreneur in the healthcare space, and we through ZS Prize certainly want to invite them to make some of these digital disruptions a reality and drive order of magnitude changes in the care and delivery of healthcare.
Something that benefits everyone and not just a few, as you pointed out right at the beginning. But, focusing back on the ZS prize, this is the second year. What are you trying to achieve in year two?
We had a great first year. We had over 30,000 registrations. The winners and the finalists of the prize have since gone and been successful in many ways. They have been able to receive funding. They've been able to receive grants. They have the recognition that they got through ZS Prize, we believe has helped them get their ideas out to the market, get their products a bit more recognition before the recognition by ZS Prize. So I hope we can continue that success with the entrepreneurs, with the companies that that participate in ZS Prize. For this year, there are a couple of other elements of the program that we are really strengthening. First, of course, is our mentorship program. So the participants at ZS Prize get mentorship, the short list of participants, ZS team members who are deep in healthcare. We provide them with perspectives on how to sharpen their idea, how to refine their value proposition for the market, and how to help them get ready for their pitch and presentation to the independent jury. Of course, at ZS Prize, we sponsor it, but the jury is entirely independent. And so for those mentorship, it was much appreciated last time by the participants, and we want to kind of take it a notch or two above, higher this time in terms of the support and mentorship that they provide. Secondly, of course, the entire ZS Global Network is available for the finalist, for the shortlist, and the winner teams to through introductions to the venture and the investment community, through ideas, through connections with our clients. So in many ways, the ZS network can be will be a resource that the participants can tap into. And so these are few learnings that we want to further pick up from our early edition and help them operationalize in addition to.
That's fantastic. I mean, you're essentially talking of an ecosystem leverage that you can give to all of these participants. What is your advice to participants who'd like to come in this year?
Yeah. First of all, would encourage all the people interested in health tech to solve for India. And this is this forum is a platform for them to showcase their ideas and get recognition. In terms of advice, I would say over-index on digital. Have a digital first mindset to the kind of challenges that we are facing in healthcare. Tap into new and creative data sources. We want them to explore the new research around social determinants of health. An amazing set of findings of the last several years has been this idea that your zip code may say a lot more about your health than your genetic code. So the care and delivery of health is as much affected by our socioeconomic conditions than just our biology. So I would very much encourage our entrepreneurs and talents to explore that research, that new set of findings to improve healthcare for the millions, for the masses. We want them to solve for Bharat. How can someone in Nagaland have access to the best of medicine? How can someone in Purulia in Bihar have access to the same medicine facilities as in Pune? So really solve for Bharat would be my earnest encouragement and request, so that we come a little bit closer to this goal of a better healthcare outcome for all. And so those would be my suggestion and encouragement to our participants. Think big, think Bharat, and think health equity for all.
Sanjay, you definitely are excited, and I'm sure there'll be lots of participants, who'd also want to walk down this path, be part of ZS Prize, leverage the mentorship, and as you say, solve for Bharat, and why not solve for the world? With that, Sanjay Joshi, thank you so very much for your time and for your thoughts today.
Thank you.